I want you to try something right now. Look down at your feet. Are they tingling a little? Cold? Even though the room isn't? Maybe you've got a small cut on your heel that's been there for 3 weeks and just won't close up. If any of that sounds familiar, I need you to keep watching, because what I'm about to show you could be the earliest warning your body is capable of giving you, and it has nothing to do with a blood test. Most people think diabetes announces itself with thirst or fatigue or a number on a scale. But for a lot of people over 60, the very first clue shows up somewhere else entirely, in the feet, and it can show up months, sometimes years, before a single blood test would ever catch it. That's not a coincidence. Your feet are about as far from your heart as your body gets, which means they're the first place to feel it when something changes in your blood sugar or your circulation. The nerves down there are some of the longest and most delicate in your entire body, and they tend to react before almost anything else does. So today, I'm going to walk you through 9 specific changes in the feet that can point to hidden, undiagnosed diabetes. Some of these you already know about. A few of them might genuinely surprise you. By the end, you'll know exactly what to look for, what it means, and what to do about it. No fear, no guessing, just clarity. Before we get into it, a word about why I'm doing this. I'm Dr. Andrea Reyes, and for years now, I've focused on helping people over 60 catch the early, quiet signs their bodies give them, the ones that are easy to write off as just getting older. That's exactly what today is about. Now, I do want to say clearly, nothing in this video is meant to diagnose you. Think of this as a map, not a verdict. If anything I describe sounds familiar, the right next step is a simple conversation with your doctor and, if needed, a basic blood test, an A1C or fasting glucose check. That's it. Early detection is one of the most powerful tools we have in medicine, and that's really the whole reason this video exists. If you're watching this for a parent, a spouse, or someone you care about, that matters too. A lot of the people who need this information most aren't the ones searching for it themselves. Let me introduce you to someone. I'll call him Walter. He's 64, retired now, but he spent over 30 years walking a mail route in every kind of weather you can imagine. Rain, snow, brutal summer heat. If anyone earned the right to say, "My feet have seen it all," it's Walter. These days, he spends his time in the garage doing woodworking, and he's always thought of himself as the healthy one in his family. No diagnosis of diabetes, though his mother had it later in life. His diet's reasonable, not perfect. He'll admit that himself. The occasional dessert, nothing extreme. But over the past several months, Walter started noticing a few small things. A bit of tingling in his foot now and then. A cut on his heel that was taking forever to close up. Feet that felt cold even when the rest of him was perfectly warm. Nothing dramatic. Nothing that screamed for attention. And that's exactly the point, and these signs rarely do. I'm going to walk you through Walter's story as we go, piece by piece, because I think you'll recognize more of it than you expect. The first sign is one of the most common, and it usually starts small enough to ignore completely. A tingling or numbness in the toes. Doctors call this paresthesia, and it happens because elevated blood sugar over time damages the small nerves that run all the way down into your feet. Think of those nerves like electrical wiring. When they're constantly exposed to too much sugar circulating in the blood, the insulation around them starts to wear thin, and the signals traveling along them start to misfire. Sometimes that shows up as a strange tingling that creeps from the toes upward. Sometimes it feels like your sock is bunched up under your foot when it isn't. Some people describe it as difficulty really feeling the texture of the floor beneath them. Research on peripheral neuropathy, that's the medical term for this kind of nerve damage, shows it can actually begin years before anyone receives an official diabetes diagnosis. That's an important point. This isn't a late-stage symptom. It's often one of the earliest. The trouble is, most people chalk it up to poor circulation or just getting older, and they let it go. Left unaddressed, this kind of nerve damage can progress and start affecting balance and your ability to feel injuries when they happen, which becomes important later in this list. Walter's version of this was subtle. He was sitting in his recliner one evening and felt a faint tingling in his big toe. He figured his foot had just fallen asleep and shook it off, literally. He had no idea it was actually his nerves trying to tell him something. But numbness is only part of the picture. As nerve involvement progresses, some people start to notice something a little more uncomfortable, a burning or shooting pain in the feet, and it tends to get worse at night. There's a simple reason for that. During the day, your brain is busy processing all sorts of other input: sounds, movement, conversation. At night, when everything goes quiet and still, your brain has nothing else competing for attention. So those misfiring nerve signals become much more noticeable. It might feel like a burning sensation on the soles of your feet that makes it hard to fall asleep, or sudden shooting pains that jolt you awake. This is sometimes called painful diabetic neuropathy, and it affects a meaningful number of people whose blood sugar has been elevated for a while without their knowledge. The mistake I see constantly is people assuming this is restless leg syndrome, or arthritis, or just getting older, without ever connecting it to blood sugar at all. Here's the thing, though. This kind of pain is actually useful information. Uncomfortable as it is, it tells us the nerves are actively involved, which is exactly the kind of clue that deserves a simple test rather than years of guessing. For Walter, this showed up as burning under the blanket at night. He mentioned it to his wife almost in passing. "My feet have been burning lately," when she gently suggested he get it looked at. He brushed it off. Again, that's how these things tend to go. Now let's talk about something you can actually see, rather than just feel: changes in the color of your feet. This might show up as a reddish or purplish tint, or feet that look unusually pale. This one comes down to circulation, specifically what's happening in the small blood vessels, what we call microvascular changes. Picture a garden hose that's been left out in the sun for years. Over time, it gets stiffer, narrower, less flexible. Something similar happens to small blood vessels when they're exposed to consistently high blood sugar. They lose some of their natural flexibility, and blood flow becomes less efficient. In practice, that can look like feet turning noticeably red or flushed when they're hanging down, or looking pale or slightly bluish when they're propped up. Research connecting chronic high blood sugar to these vascular changes shows they're often visible well before more serious complications ever develop, which is really good news if you catch them. The common mistake here is assuming it's just cold weather, or sitting cross-legged too long and never thinking twice about it. Left unaddressed over years, these vascular changes can contribute to more serious circulation problems down the line. Walter's wife was the one who noticed this, actually. After his evening walk, she commented that his feet looked more flushed than usual, more than she remembered from before. It was a small comment, but it was another piece of a pattern that was quietly forming. That leads naturally into a related sign: feet that stay cold, along with a pulse near the ankle or top of the foot that feels weaker than it should, or is hard to find at all. If you think of blood flow like water pressure moving through a pipe, when the vessels narrow, less pressure reaches the farthest points, and your toes are about as far as it gets. That's why cold feet, especially when one foot feels noticeably colder than the other, can be a meaningful clue rather than just a personality trait some of us have. This shows up as feet that stay cold even in a warm house, or needing an extra pair of socks all year round when you never used to. Reduced circulation in the extremities is a well-documented early marker of metabolic changes in the body, and it's easy to miss because it feels so ordinary. The common mistake is assuming it's simply poor circulation from getting older without ever asking why. And here's where it starts to connect back to that first sign we talked about. When cold feet combine with reduced sensation, the risk of an unnoticed injury goes up quite a bit, because you may not feel a problem developing until it's more advanced. Walter mentioned this almost as a joke to his wife, that his feet were always cold now, even in wool socks, which puzzled him because he'd always been the one who ran warm, not cold. Little did he know, that offhand comment was fitting neatly into everything else that had been building. Before we go any further, I want to pause here for a moment. If anything so far sounds familiar, The tingling, the nighttime burning, the color changes, the cold feet. I'd genuinely like to know. Drop a comment below and let me know which one, if any, sounds like you or like someone you love. You're not alone in this, and honestly, these conversations in the comments help other people recognize the same things in themselves. Now, the signs we're about to cover are even more important to catch early, especially the ones involving healing and skin, so stay with me. The fifth sign is one of the more serious ones on this list. Cuts, blisters, or sores on the feet that take an unusually long time to heal, or that seem to close up and then reopen. This happens because elevated blood sugar interferes with your body's natural healing process and immune response. Think of healing like a construction crew rebuilding something. They need a steady supply of materials to work efficiently. In your body, that supply is oxygen and nutrients carried through the blood. When circulation and nerve function are both compromised, that construction crew works much more slowly, and a cut that would normally close in a week can take 3 or 4 instead. This is where the earlier signs start to matter even more, because reduced sensation in the feet means many people don't even notice a wound is there until it's already become a problem. That's not a coincidence, either. Nerve damage and circulation changes tend to work together, which is part of why healing slows down so much. If there's one sign on this list I'd ask you to take most seriously, it's this one. A wound that isn't healing the way it should is worth a phone call to your doctor, not a wait-and-see approach. This is the turning point in Walter's story. Remember that cut on his heel from his work boot? Weeks had passed and it still hadn't fully closed. That's when his wife finally put her foot down, so to speak, and insisted he mention it at his next appointment. And this time, he actually listened. Related to that is another sign that's easy to dismiss as purely cosmetic or dry, cracked skin, especially around the heels. Diabetes can affect the nerves responsible for regulating sweat and oil production in the feet, and when that regulation breaks down, skin can become unusually dry, flaky, or deeply cracked. Picture a garden that stops getting proper irrigation. Over time, even healthy soil turns dry and brittle. Something similar happens to skin when its natural moisture regulation is disrupted. In real life, this can look like heels that crack deeply enough to catch on your socks, or skin that stays rough no matter how much lotion you use. This connects to something called autonomic nerve dysfunction, which affects the nerves that control functions you don't consciously think about, including skin hydration. The mistake people make here is treating it purely as a cosmetic issue, buying heavier creams, more foot soaks, without ever considering it might be a metabolic signal rather than a dryness problem. And this one matters more than it might seem, because cracked skin combined with slow healing, which we just talked about, creates an easy entry point for infection. For Walter, his wife noticed his heels had become rougher and more cracked than usual, even though he was using the exact same moisturizer he always had. It was one more piece quietly falling into place. The seventh sign is something a lot of people notice, but rarely connect to blood sugar: swelling in the feet and ankles. This can come from a combination of things: circulation that isn't working as efficiently as it should, nerve changes that affect how blood vessels regulate themselves, and in some cases, early strain on the kidneys from prolonged high blood sugar. I like to compare it to a drainage system that becomes sluggish when it's been overworked for too long. Fluid just doesn't move through as efficiently as it used to. Practically, this might look like your shoes or socks leaving deeper indentation marks by the end of the day, or ankles that look visibly puffier in the evening than in the morning. Persistent swelling, especially if it's new or if it's only happening on one side, deserves medical attention because it can point to several different underlying issues worth ruling out. The common mistake is blaming it entirely on standing too long or eating something salty without ever considering blood sugar as a factor. When swelling shows up alongside the other signs we've already covered, that combination makes a much stronger case for getting checked. For Walter, it showed up as his usual shoes feeling tighter by the end of the day, something that had genuinely never happened to him before. Now the eighth sign is one that fewer people know about, but it's worth understanding because it shows why catching things early truly matters. In cases where blood sugar has gone unmanaged for a long time, nerve damage combined with weakened bone structure can actually change the shape of the foot itself. A flattened arch, or what's sometimes called a rocker bottom appearance, in a condition known as Charcot foot. I think of the foot structure like a bridge held up by support beams. If those beams take repeated stress that goes unnoticed and unrepaired, which can happen when reduced sensation means small injuries go unfelt, the whole structure can eventually start to sag. In everyday terms, this might show up as shoes that suddenly fit differently, or a noticeable change in the way someone walks. This is a less common sign, and it typically develops after years of blood sugar that's gone unaddressed, but it's also exactly why we're spending time today on the earlier, quieter signs. Because those are the ones that let us intervene long before something like this ever becomes a possibility. This isn't part of Walter's story, at least not yet, and that's actually the point. By paying attention now to the earlier signs, he's giving himself the best possible chance of never getting anywhere near this one. Which brings us to the ninth and final sign, one that's extremely common and often dismissed as nothing more than a hygiene issue: frequent fungal infections or toenails that have become thickened, discolored, or crumbly. Elevated blood sugar creates conditions where fungus can thrive more easily, and reduced circulation and immune response make infections harder to fully clear once they take hold. I sometimes compare high blood sugar to leaving a bowl of sugar water out on the counter. It naturally attracts and feeds things you'd rather not deal with. In real life, this might look like toenails that have grown noticeably thicker or more discolored over the past year, or athlete's foot that keeps coming back no matter what you try. Recurring fungal infections have been linked to underlying blood sugar imbalance in a meaningful number of cases, and honestly, this is often the sign that finally gets someone to book that doctor's appointment because it's visible and it's frustrating, and that's exactly what happened with Walter. Between the tingling, the slow healing cut on his heel, the cold feet, the swelling in his shoes, and now a thickened, discolored big toenail that wouldn't clear up, the pattern had simply become too obvious to ignore any longer. He finally called and scheduled an appointment with his doctor. At that appointment, Walter had a simple A1C test done. Nothing invasive, just a blood draw. The results showed his blood sugar had indeed been running high, placing him in that early range between prediabetes and early type 2 diabetes. And here's the part I really want you to sit with. That news wasn't a disaster for Walter. It was a relief. Because he caught it early enough that lifestyle changes and regular monitoring could make a real, meaningful difference in where things go from here. He didn't need to feel afraid. He needed information, and his feet gave it to him well before a routine checkup ever would have. So let's bring it all together. 9 signs: tingling or numbness in the toes, burning or shooting pain at night, changes in foot color, feet that stay cold with a weak pulse, cuts or sores that heal slowly, dry and cracked skin around the heels, swelling in the feet and ankles, changes in the shape of the foot, and frequent fungal infections or nail changes. No single one of these confirms diabetes on its own. I want to be really clear about that. But if you notice 2 or more of them together, that's a strong enough pattern to justify a simple, inexpensive blood test from your doctor. My advice is straightforward. Check your feet regularly, or a loved one's feet if you're caring for someone who might not think to look themselves. Pay attention, especially between the toes and around the heels. Wear shoes that actually fit well. And please don't wave these changes away as just getting older, the way Walter almost did. I'll leave you with this. Early detection is one of the most powerful tools we have, and that's really the entire reason I made this video, to help you catch things the way Walter eventually did, before they become bigger problems than they needed to be. If this was helpful, consider subscribing, because I'll keep making videos like this one, focused on the quiet, early warning signs our bodies give us that are so easy to miss.